Hi, Mitch Hauschel, Maximum Training Solutions. I've talked in some other videos about using a tab taping technique. So when we talk about using rock tape, one of the things we really discourage people on is putting a lot or any stretch on tape. We're just finding that there's really no better results with stretch versus without stretch. But when you do put stretch on tape, you run the risk of having blisters, skin irritations, things like that. So for the most part, we really aren't recommending using a lot of stretch on tape. With that being said, we can use a tab and really protect the skin. What the tab does is it goes on to a specific area of the body and it gives us a lot of control over it, but also because of the way we make the tab, it really protects the skin. So I protect the skin to allow me to put a lot of stretch on it if I want to, but then also it does give me some control over a specific area of the body. Now, typically when I look at the tab, I look at things like foot drop taping or arch taping, and those are some videos I've put together in the past. And those are the techniques I typically use with the tab, but we can also use it to reduce pain. So we can use it over certain areas of the body to basically close up tissue, bunch up tissue, which sends a signal to the brain that that tissue is normal, that joint space is closed, and it will reduce that pain. So some areas of the body that I think of that I think this works really well on is maybe the medial or the lateral knee. So if they have an MCL sprain or MCL tear or an LCL, or the UCL in the elbow for like a pitcher or a thrower, or even like the AC joint. These are all great places where maybe we have some sort of a ligament tear or ligament sprain, the joint feels a little bit unstable, so we're getting a pain signal from the brain because it feels threatened. So then the idea is if I maximize the stretch over that area, so say it's an MCL, I can actually use the tape to bunch this area up, and it actually makes the brain feel as though that joint, that medial joint space is now closed. And so once it feels closed, now it feels safe, there's no pain or problems. Now, the problem is it's not no pain or problems, there's no pain. I want to be very clear on that. So you may be able to reduce pain with the tab taping technique, but you're not replacing that ligament. So I do want to be careful. There's still an underlying issue underneath of there. We can't minimize that. So if you're going to do this over an MCL to reduce pain, I would not expect them to go out on the field if they're an athlete and go play, or to go do something that's kind of wild and crazy that's going to put that knee at jeopardy. So you do have to be careful with that. But what I do like this for is a lot of people, maybe they've had an acute MCL sprain or acute LCL or UCL sprain or something, an AC, and they're having trouble just functioning. They can't sleep. They're sitting in class or they're at work and they're just having this ongoing nagging pain. We can reduce that pain. We can reduce that threat with the tab taping. Or in a rehab setting, say I've got that compromised knee, I want to start to get some strengthening and some movement. I can get to that faster because I'm reducing the threat at the knee, reducing that pain. So it's a great way we can start to look at some of those things. So how do we do it? So number one, I basically have two pieces of tape. One's short, one's a little bit longer. The short one, I'm going to make a tab. So the way I make a tab, and I'm going to come in a little bit closer just so you can see how I do this. The way I make a tab is I'm going to tear the paper back in the middle, and then I'm going to pull it together, or basically fold it together. So pull it back, and I'm going to fold it on itself and stick that down really well. So this right there is the tab. This is stuck together. This is what's going on the skin. So if I'm going to do an MCL, I'm going to take it here, and I'm going to take my tab, and I'm going to put it right over the distal or the bottom part of that MCL. So now I'm going to stick it down really well. Notice I have really good control here. That's an advantage of the tab, is once I grab that with tape, I'm going to have really good control over that. So now what I'm going to do is take my second piece of tape, and I'm going to anchor it down low, no stretch, till I get to that tab. Now I'm going to grab that tab, make sure it's stuck down really, really well. Now from here, this is where the stretch happens, okay? So we don't want to put stretch on tape unless we use a tab. So we're using the tab here to help us. So I'm going to put my thumb on that tab to make sure the tape doesn't pull off of that tab. And then I'm going to stretch and then lay it down. And then the rest of this gets no stretch. So from here to here, I've got a really big stretch on that tape. and then no stretch, no stretch. We never stretch the anchors no matter what. So right now I'm feeling a little bit of artificial, maybe artificial stability. I don't think it's actual stability, but I'm getting some neurosensory feedback, and I can definitely feel that tape squeezing on this inside part of the knee and this tissue. And I can actually take my finger and slide it under here, so you can see that tab is there and it's doing its job. We could make an X if we wanted to. We could just do one piece. We could do two pieces. I'll let you figure that out. But again, we can use this just to reduce that threat, reduce the pain, which allows you to get to ADLs, maybe allows them to rest better, sleep better, or maybe we utilize it in order to start us with some basic fundamental movement patterns that they couldn't accomplish before. But just use caution. Remember, you haven't changed the stability of that joint, but you have downregulated pain, which is the first step to the recovery process. So thanks for watching. We'll talk to you more soon.